I'm Dr. Selma Kelmies, a trustee of the Wood Library, and I'm here to talk about another outstanding female anesthesiologist, Dr. Gertie Marx, who was born in 1912 in Germany. She initially went to medical school at the University of Frankfurt, and after 2 years, Nazism was growing. Jewish people were pushed out of professional schools, and she fled to Switzerland, where she completed her MD degree at the University of Bern in 1937. She then immigrated to the United States, fleeing the difficult situation in Europe. Here she had to take a number of exams, which she passed, except having trouble with the oral English exam. Then she sought an internship, and this was very difficult for women at that time. She finally was able to get an internship at Beth Israel Hospital in New York City when a male candidate dropped out, and all women interns were having trouble getting positions at that time. It was a rotating internship, and her second rotation was on surgery. They also, at that same time, rotated on anesthesia. She soon found that she wasn't strong enough to hold the retractors during abdominal surgery, and so the powers that be sent her to anesthesia full-time, where she spent the next 4 months, and she discovered that she loved anesthesia, and this became her career. She was a very dynamic and ebullient teacher, and had many talents in developing teaching techniques, and also studying obstetric anesthesia, which is the area where she spent the greatest part of her time. Her contributions to OB anesthesia were proving that hydration before spinal anesthesia for a C-section prevented hypotension, which can be such a problem. She also documented aortocaval compression, and this was a very important step, convincing people to use uterine displacement during induction of anesthesia for C-section, and then proved that regional anesthesia for emergency C-section was perfectly feasible and safer for both mother and baby. She left a great legacy, more than 150 articles and a number of book chapters. Our archives for her consist mainly of her many awards, including an award from Queen Elizabeth II. This is one artifact that we do have from her. I'm sure she didn't use it, but she must have acquired it in Germany at some point. This is a Laennec wooden stethoscope. When doctors first began to study the heart, they would put their ear directly to the chest over the heart area. And of course, this was very difficult for women patients who were not to be exposed to quite so closely to male physicians, and most physicians were males at that time. Laennec in France developed this, I believe it was 1816, a two-piece wooden tube. It's hollow in the center, and then the bell-shaped dome, which would be placed over the chest at the heart area, and then your ear would go to the upper hole, and you were safely separated from the woman's chest wall. So this is a very poignant piece of equipment that shows doctors' attempts to take better care of female patients in many aspects, and Dr. Marx certainly made enormous contributions in her work in this area of better care of women patients. Dr. Marx was a feisty, short little woman, and was very frank, and especially in the argument situation. And many people remember this as part of her character. But it, I think, helped her to sell her ideas about the care of obstetrical patients and improved anesthesia care for all patients. We're very lucky to have this stethoscope, which she donated, and also her awards and a few other papers in our collection. Thank you.